Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and I have several people in the studio today talking about a postpartum support class. So joining me is Miss Becky Botter, Carrie Ackroyd, and Lynda Snider. How's it going? Y'all doing all right?
Yeah, we're doing great.
Good morning.
Good morning. Thanks for coming in today. So like I said, we're going to be talking about a postpartum class. The class is named Mama, You've Got This. Now, I am not a dad. I have several friends who are parents and recently became new parents, and I think a lot of them could have really benefited and learned a lot from going to this class, and I'm glad it's an option for new parents out there, and specifically new mothers. So before we get into that, I'd like to just kind of introduce you, find out what you like to do outside of work, find out what you do for work, and then we'll kind of dive into it. Miss Becky, how about we start with you?
I'm Becky, and I am a nurse on the postpartum floor, which means that I take care of moms and babies after delivery.
Okay.
So, and we also are doing education. We're also discharging them to go home. So we're with them through that process. And so I'm a nurse on that floor. I also teach childbirth for the hospital, childbirth classes for the hospital. And I'm also a dietitian. I'm kind of just do a lot of different things. And I'm a certified lactation counselor. So that's kind of what I do for work. That's my areas of interest. And I myself have 6 children. So
wow.
I'm married and have 6 children. Yeah.
Congratulations.
Thank you.
A quiet household is not a thing at your house, right?
It is. There's 20 years difference between the oldest child and the youngest child. So we span a couple generations almost.
That's awesome. That's really cool. Miss Carrie, what about you?
So my name is Carrie Ackroyd. I am the in-home counselor and mental health consultant for Healthy Families.
Okay.
And I love doing it. I provide counseling services for those moms in that program suffering from postpartum depression or anxiety disorders. And when I'm outside of work, I love spending time with my husband. We watch movies. I love to go shopping, all of that stuff.
Nice. Normal person. Miss Lynda, what about you?
I'm a community educator with the West Tennessee Women's Center and Ayers Children's Medical Center here at the hospital. And so I'm involved with organizing different classes for our expected parents in the community, different educational programs. Outside time, I love to be outside, spend any kind of outdoors, working in the yard or anything outdoors. I love it.
Cool. Well, great. I'm glad to get to know you guys a little bit better before we dive in. So speaking of diving in, let's do that now. So like I said, the class is called Mama, You've Got This. It's a postpartum support class. So what is it and why do you guys offer it?
Okay, the Mama You've Got This class, we really wanted to focus on new moms, giving them those extra support once they've gone home from the hospital. Mm-hmm. When you're pregnant, you do a lot of planning, pre-planning as far as prenatally, and kind of get a plan how you want to have your child, time you spend at the clinic, time that you want to spend at delivery, but not a lot of them plan after they go home and what am I going to do when I get home. So this gives them that extra support. Recent studies show that like 40% of women don't attend their postpartum visit, their checkup with their physician. And so we want to give them that added support that, hey, this isn't really what I thought it was going to be when I get home with my baby, what I was not expecting after I got home. And so this might be a great opportunity for them to join us and be with other new mamas. It's a virtual class, so we want to be sure to keep people safe at home for now anyway, and so they can join us virtually after they get home.
Okay. So what are some of the topics that are being covered in the class?
Some of the topics that are being covered are health-related issues, like physical issues such as high blood pressure, warning signs, things that you might mom might say, if we can tell the mom, if you notice this, you should call your provider. If you notice that, you should call the provider. And we certainly don't want to, we're not taking the place of, medical advice, but those sorts of things. So health-related things, blood pressure, infection, for mom and for baby. And then I'll let Carrie talk about the mental health aspect. But we also want to be a place just for exchange of information, for, support, encouragement. I think that when women have babies, like Lynda said, they're so focused on the pregnancy and birth, which is super important. And they think a little bit about, the postpartum, maybe how they're going to take care of their baby, how they're going to take care of themselves after the baby is born, but that hasn't been the biggest focus. So so your baby's born, and then it's like a switch just gets flipped, and all of a sudden, we're thinking about recovery and infant care and health-related issues, and who's going to be at home to help me do what I need to do, and when is my support person, when are they going to go back to work, when will, how long will I have help, how long won't I? So all those sorts of different things we want to be able to talk through with people and give them suggestions and encouragement in those areas. And then of course mental health issues, which Carrie, she's our expert.
Perfect.
In that.
Let's talk about that then.
The things that we call postpartum mood disorders is perinatal mood and anxiety disorders. So that's PMAD. So if I say PMAD, that's what that stands for.
Okay.
So like I said, PMADs are perinatal mood and anxiety disorders. And a lot of people are like, well, what's the difference between a PMAD and the baby blues, right? Because we hear about the baby blues. Baby blues happen because of just that hormone fluctuation, and usually can level itself out after about 2 weeks after the baby is born. So if it lasts longer than 2 weeks or interferes with taking care of the baby or interferes with your life in a major way, most likely it's a PMAD, and then you kind of seek outside help for that.
Okay.
There's a lot of different symptoms to look out for with the PMADs, and some of them are problems concentrating, feeling guilty, sadness, anger, rage, believing that you're a bad parent, not wanting to get out of bed, avoiding contact with that family, having trouble sleeping, eating. You kind of have your typical depression symptoms with an added anxiety related to the child. So there's a lot of times moms will have what we call scary thoughts. And a lot of moms are really embarrassed to talk about that or think that they are a bad parent because they're having those thoughts, but they're actually really normal with a PMAD. So moms should not be ashamed for those thoughts and really should get help when they realize they have them.
Gotcha.
And I mean, anyone can get it, but there's some people that are a little bit more high risk than others. And fun fact is dads can get a PMAD too. And I don't think a lot of people know that.
I'm sitting here in silence. I don't know anything that you're talking about, so I'm learning, So what does that look like for the process for the dad of working on that mentally? I'm sure it's not the same as the mom. Maybe it is. I could be wrong. But
Honestly, it's very similar because there's a lot of different ways you can handle the perinatal mood and anxiety disorder. So it could, obviously, I'm a big advocate for therapy because I'm a counselor.
Sure.
And so the therapy for moms and dads would look very, very similar. Just
Gotcha.
working on the thoughts and how to move through them. Dads, kind of from my research, show a little bit more anger when they have depression than the moms do. Moms tend to internalize a lot more.
Okay.
And that's just men and women and how they kind of display.
The wiring of,
sure.
display
how their mental health.
That makes sense.
And I think a lot of times, too, the dad is frustrated because he's wanting to try to help his wife and doesn't really know how to help her when she doesn't really know what all's going on with her as far as her body healing back after delivery, and everybody's sleep deprived. You've got a new baby in the house.
Yeah.
If you didn't sleep beforehand, you're sure not going to sleep afterward for a while. So I think there's a lot of added anxiety there too with that.
Yeah.
And it's hard to anticipate that. It's kind of one of those things you don't really know what it's going to be like until you're there. And especially for first-time parents. But even for people who are not first-time parents, every experience, new baby experience is not the same. So, and I think one thing that I was just thinking about is that in life, especially women, but I'm sure men think this too, is am I the only one? Am I the only one that's struggling with this? Am I the only one that's having this symptom? Am I the only one that's having this problem with their issue with their baby? So this will be an environment where we can explore things like that, what to expect, what are red flags and how to deal with, just different circumstances and situations.
Yeah, that's great to know that there's teachers out there to help those people that need that.
And
That's
if you
great.
know ahead of time that this is normal and what's not normal, then you can kind of work through that. Carrie, you were talking about when we met before about having that little caddy with the snacks and things, just tips for moms on how to make it easier after delivery. Anybody want to add?
Yeah, practical things. So we want to cover practical sorts of things, and we'll be addressing practical things at each class. And so ideas, tips, suggestions for how to make things easier, and it's kind of a way to brainstorm,
Sure.
because when you're at home, some moms, that's a huge change for them. Maybe they're used to being in the workforce and interacting with many women every day, and then going to be at home at least for the postpartum period where they don't have those same interactions and people to make suggestions like, hey, why don't you try this or why don't you try that? And so we hope to be that.
Yeah.
And all of us have different support systems. Some of us have a lot of support with family. Maybe we got a big family, lots of friends who will feed us and bring us food for the first week or so after we're home, but others don't. And so you just have to kind of plan ahead of time. Hey, after I get home, maybe I've already got some food in the freezer that we could, Dad could warm up or somebody can warm up real quick for us and prep.
And we certainly see that at the hospital. There's a pretty broad range of, like Lynda's talking about, support and not as much support. And so not everybody's in the same situation,
Right,
for
of
sure.
course. So when it comes to the class, how often do those classes take place? Is it once a week, once a month?
We're starting out offering this once a month, and
Okay.
it's going to be virtual. If anybody's interested, they can find out more information on our WTH website.
Okay.
And look for the class dates. They will be offered monthly to start with. This is brand new, so if we get a large number of participants, then we might consider offering more than once a month. But any new mom, it doesn't have to be someone that delivered at one of our West Tennessee Healthcare hospitals. They can attend because it's virtual.
Right,
It's in
okay.
the afternoon from 1 to 3. Anybody that is interested can find out more information on our website.
Okay. What I'll do, listeners, and to you guys in the room, I'll put the link in the description. So if you're looking for the link and you want to sign up, just click the link and it'll take you right there. Classes are from 1 to 3. Is that correct?
Yes, they'll be 1 to 3.
Are they always going to be virtual, or is that just the plan for now? Or
It's the plan for now. We used to do a support group for new moms where they actually brought their baby with them years ago, but right now we're offering virtual.
right, sure. Are there any more physical issues that are going to be covered in the class?
Well, there's a whole list that hopefully when we get our moms together, they will talk through kind of what's going on with them. But it is good for them to know ahead of time. Becky had talked about what's normal and not normal with high blood pressure, things to look for. Maybe you've never had high blood pressure before to your pregnancy, and then you end up with issues that your provider can help you with. And then she talked about infection, but also another area that we don't talk about too much is our sexual health after delivery. Our bodies have had a baby, and so we've either possibly have an incision from a C-section, or we might have stitches in our bottom from delivering. And so there are issues to think about and what's normal. How's that going to heal up? When will I be able to, have intercourse again? Is it going to hurt when I have intercourse? Things to talk about. Am I having issues going to the bathroom, as far as urinating? And the good news is there is help out there if you are having issues with this. Your provider can help, and then also there are actually trained physical therapists in women's health. And our Sports Plus group here with West Tennessee Healthcare has some trained therapists. So that is an option locally. If you need that, then your provider can get you fixed up with that.
Yeah, I've actually done a podcast with some Sports Plus people from Lexington, I believe, who talked about sexual health specifically after having a child. So it's great.
Yeah.
Yeah.
It's great. So help's out there.
Yeah,
But
that's the big takeaway I think people need to understand when it comes to women giving birth. You're not alone. I'm a guy, first off. I've never obviously been through this. I'm not a dad.
Well, you'll
yet,
need to
but-
know one day.
Yeah, one day. But yeah, I think it's just important for people to understand that you're not alone. You're not the first person to have this happen to you.
You're not the only person.
Not the only person. And there are tons of people out here within our system who are willing and able to help with any issue you might be having. Listeners, if you're having issues, don't hesitate to call them. Don't hesitate to check out the website. This class could be a major helpful tool for you to use just in getting back into a new normal life. Well, this has been great. Again, I feel like I've said I'm not a dad on a bunch of podcasts, but being in the role that I have, I get to learn all kinds of new things, and I love it. It's great. So, like I said, listeners, if you're looking to sign up for this class, the link will be in the description of the podcast, as well as contact information for anyone who was on today. If you ever have any questions, feel free to email or call them, and they will be more than happy to answer your questions. Miss Becky, Carrie, and Lynda, thank y'all so much for coming in today. I really appreciate it.
Thank
you.
you.
Absolutely.
Great day.
Thanks, and y'all have a good day as well. This has been another episode of We Talk Health.